You never get a second chance to make a first impression. Things I'm looking for in an interview are eye contact, handshake, a nice firm handshake, being engaged, being prepared, knowing the position that you're applying for.
I usually send out some information before the interview, and I tell them where we're going to be, what time it is. I ask for references, and so the first step is, did they follow the directions I left in my email? Did they bring references with them? Did they show up on time? Did they wear the appropriate attire? Do they look like they're here for an interview, or do they look like they just woke up and rolled out of bed?
They can answer the scenario-based questions appropriately, because then that kind of gives us an idea of, oh, hey, this person already knows they're using their because we develop the questions so that they use kind of their critical thinking.
Really like it when a person I'm interviewing gives real-life examples. I want to hear that you're dedicated, that you're a lifelong learner. I want to hear that you're a team player and that you are basically on a growth trajectory.
I am looking for like your qualities, what makes you stand out above the next person that you're interviewing against, but not to be, I don't want you to brag too much. Like, yes, tell me what you're great at, but you need to also bring it back down and show that you're a part of a team as well.
So what makes a candidate stand up above everyone else is the personality. I'm looking for someone that will connect not only with my patients or our patients, our veterans, but also someone that will connect with the staff. Because having a close-knit community is what matters. Because that you know that if the community is close or that team is close, then they'll be able to care better for those patients.
I would say for new grad nurses, decide what you're passionate about. You've had a chance to go and check out all aspects of nursing and decide what you're passionate about, what hit you the most when you were there. Know what you want. Don't go into an interview thinking, oh, well, I'm just, I just need a job, I just need a job. You need to know what interests you, what drives you, what is going to be most important to you, and let that show during the interview.
A perfect nursing interview can vary from person to person. Are you asking appropriate questions? Are you engaged? Is this a job that we can see you're passionate about? Do you care about the patients you're going to care for? In this case, we're caring for veteran patients. What is your why? Are you explaining that why? And how does your why relate to the job you're applying for?
I want to hear that you're going to commit to working in our unit. I really put a lot of time and energy into training our nurses, and I want to feel like you're going to give me something back in return.